Good afternoon, everyone. It's 2 o'clock. Thanks for joining us. On the briefing today, we have Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, and Marlena Jackson, Deputy Commissioner for Community Health at the Milwaukee Health Department. County Executive Crowley, you're up first.
All right, thank you so much, Sydney, and good afternoon to everybody. And first and foremost, I'd like to say happy March. Not only is this a month where we get to acknowledge and celebrate the many contributions that women have made throughout our history, but it also means that spring is just around the corner and soon we'll be able to enjoy the warm weather. And so although we must stay vigilant in practicing physical distancing and mask wearing, I want to encourage you to step outside, get some fresh air and enjoy the upcoming sunny days that we have. And I'd like to give a quick update on our Milwaukee County's Office of Emergency Management's vaccination efforts. So as of today, nearly 3,000 vaccines have been administered by the Milwaukee County Office of Emergency Management. And all Milwaukee County employees, eligible Milwaukee County employees, have been invited to the CASI site to receive their vaccine. And so we continue to focus our outreach on underrepresented communities in Milwaukee County as this vaccine continues to roll out, which is also part of our commitment to equity and serving our most vulnerable populations. So as more vaccines become available, we hope to expand our vaccination efforts to ensure that everyone in Milwaukee County who wants the COVID-19 vaccine is able to get one. And not every day do I have the opportunity to share some good news on one of these briefings. So today, I'd like to take a moment and acknowledge a positive step that is taken by one of our communities to address one of the root causes of COVID's inequitable impacts on our community, which is housing insecurity. And last night, the Village of Shorewood voted unanimously to allocate $2.5 million for affordable housing. We know that the pandemic has exposed the deep racial disparities in our health of our community. And in the last year alone, life expectancy for Black Americans fell by 3 years, while life expectancy for white Americans fell by 1. And so we know that these disparities stem directly from underlying racial disparities in the social determinants of health, such as housing. Over 50% of Milwaukee County households are rent burdened, with Black American households impacted at twice the rate of white households. So increasing housing security not only helps families reeling from the pandemic, but it also builds more diverse and inclusive communities where we have an opportunity to thrive. And I'm hopeful that communities across Milwaukee County and all of Wisconsin, quite frankly, follow in Shorewood's footsteps to truly invest in equity. Milwaukee County and our partners, we've been aggressively pursuing more resources to invest in equity and get through this pandemic. So we're excited to see some more movement at the federal level on this topic in particular. So last week, the House narrowly approved the federal COVID-19 relief bill, which includes $1,400 in direct payments, a $400 a week federal unemployment bonus, and billions of dollars to distribute coronavirus vaccines, as well as assist schools and local governments. Although this is encouraging news, we still have a long way to go, as this bill has to pass the Senate now. So we understand that the goal is to pass and begin implementing this bill by mid-March, as unemployment insurance benefits are scheduled to run out. So during these times, it can feel like there is not much good news to highlight. So I'm encouraged to see that state and local aid is included in the current package, which means Milwaukee County is projected to receive roughly $185 million in aid. This type of flexible funding will allow us to continue adequately funding our COVID response as well as our recovery. And in all the local municipalities, including Milwaukee County, we are responsible for running emergency management operations, operating our local health departments, administering public testing sites, and providing public health information. We're also responsible for developing and administering economic support programs that assist individuals and families who have been adversely impacted by this pandemic. So we continue to provide the regular services that our own residents rely on. The direct allocation of these funds to counties is effective and efficient, as we can cut through many of the bureaucratic delays and tap into our local partnerships to keep support out, to get support, out to our residents as quickly as possible, but also in a responsible and transparent manner. So with that, I'd like to say thank you and hand it over to Mayor Barrett. Mayor.
Well, thank you very much, Mr. County Executive, and good afternoon, everyone. We've been very, very busy at the city working because of the new month. This means that there's a new group of people who are eligible to receive the vaccine in order of priority. That includes educators, and not just educators, but childcare workers as well. We have a lot of childcare workers in the city of Milwaukee. So if you are a childcare worker, you are now eligible to receive the vaccination. Individuals who are enrolled in Medicaid long-term care programs, some public-facing essential workers like bus drivers, like people who work in grocery stores, some non-frontline essential healthcare personnel, and staff and residents in congregate living facilities. But we clearly have spent a lot of time working with schools to make sure that educators can receive the vaccination. And I want to thank the state. The state's been very, very cooperative. We've worked closely with the Milwaukee Public Schools and other schools in Milwaukee. So if you are an educator who works or lives in the city of Milwaukee, you are now eligible to receive the vaccination. We will continue to prioritize previously eligible groups. That means healthcare providers, people over the age of 65, first responders, and residents of long-term care facilities who have not yet been vaccinated will still be at the front of the line. I've been watching the numbers for people over 65, and it's good to see that number continue to grow. The number of people over 65 who have received either one or both vaccinations, both numbers are growing, and we're going to continue to push that as well. We do ask that people remain patient and understand that eligibility, unfortunately, does not equal availability. But I think as we all recognize from the news at the national level, things are really, really ramping up, particularly with the announcement over the weekend that the J&J, the Johnson & Johnson vaccination is out. I think that that's going to provide obviously a lot more alternatives to people. But at the Wisconsin Center, we will continue to prioritize all educators until next week through March 15th, and will serve eligible populations for residing or working in the city. Again, our goal is to get all educators done by March 15th. We've been working very, very closely with the Milwaukee Public Schools, with the superintendent, with the school board. They have set their calendar so that the students will be going back to school April 12th, April 19th, April 26th, and sort of a staggered term. And we want to make sure that we have the vaccinations in the arms of people before they return into the classroom. So that's our priority right now, along with people over 65 and healthcare providers. To do this, the Milwaukee Health Department is increasing the hours and the capacity of the vaccination site at the Wisconsin Center. Yesterday, over 1,000 individuals received their vaccination there. And eligible individuals can sign up for vaccination appointments through the Health Department scheduling portal at milwaukee.gov/COVIDX or by calling 414-286-6800. Next week, there will be, and I hope it's at least 8,000 first doses of vaccine at the Wisconsin Center, in addition to second doses and in addition to doses at the mobile clinics. Again, we're working very, very closely with the state, and I'm thankful to the governor and the state for working with us. But we will see state-supported mobile sites that will run Thursday and Friday this week, one time only. And to be clear, the sites will not be public, but we are pleased that the vaccine will be getting out into the community and that we are ensuring it is administered equitably. We'll get you more information about that Thursday in our briefing. So testing remains an issue, although those numbers continue to drop. As we announced last week, the American Family Field testing site is open Monday, Wednesdays, and Fridays. And we had 525 people on Monday. We had 86 people at the Northwest Health Center, 61 at the South Side, so only 672 people. I'm hoping that that's because fewer people feel that they have the disease or feel that they've been in contact with someone. And Dr. Weston can talk about those numbers because we have seen some favorable trends. But again, as you look at the national news, there clearly is a concern coming out of the CDC and other healthcare professionals as to whether there's a potential for a fourth wave. But I continue to be pleased as I look at where Wisconsin continues to drop in terms of our rankings, which is good over the last several weeks. We're in the mid 40s among the 50 states as to the number of people who have the disease, although overall, we're still basically the state that has the 10th highest per capita number of people who have contracted the disease. So Recently, it's gotten better, but we had such a rough patch there from basically November 1st through the end of the year that's kept us essentially in the top 10 list that we don't want to be in. But please continue to seek testing if you are experiencing symptoms or you think you may have been exposed to someone who has tested positive for COVID-19. And with that, I will turn it over to Dr. Weston. Dr. Weston.
Thank you, Mr. Mayor. Good afternoon. First to our numbers, we have had 97,999 confirmed cases of COVID-19 in our community and 1,057 individuals who've died in Milwaukee County. We are moving closer to obtaining detailed vaccination data from the state in order to provide more information on the public county dashboard related to the geography as well as more detailed trends in vaccination in our community. We've talked about cautious optimism with regard to our trends and our numbers in the community. That certainly continues, but now with a greater emphasis on being cautious. We're seeing a slight inflection point in our case numbers as well as in our testing numbers, much like many other parts of the country. Luckily, our overall numbers remain low, but this change in trajectory will certainly be something to keep a close eye on. The two major items that threaten another spike are a loosening of vigilance with personal precautions, as well as the increasing transmission of the new and more contagious variants. By addressing one of these threats, we can also address the other. That is to say that by maintaining our vigilance in masking and distancing, we can also slow the spread of the new variants and result in a blunting of any coming spike in cases. And of course, a key component of blunting that spike is also getting as much of the population vaccinated as quickly as possible. And this week, for the first time, we're so pleased to now have 3 authorized vaccines to provide to the community with the addition of the new Johnson & Johnson vaccine shipping out to our state as we speak. And this is a welcome addition in a time of undoubted short vaccine supply. And the Johnson & Johnson vaccine has the added benefit of being easier to store, to transport, and to administer, particularly in more casual settings such as community centers, shelters, and even homes. Now, with the Johnson & Johnson vaccine soon to be available alongside the Moderna and the Pfizer vaccines, there's questions about which one should I get? Which one is the best vaccine? And the answer to that is whichever vaccine is offered to you is the best vaccine for you. We're lucky to have 3 highly effective and extremely safe vaccines available. The efficacy number for Johnson & Johnson are a bit more complicated than Moderna and Pfizer, as the Johnson & Johnson vaccine trials took place in many different areas of the world with different variants in place, leading to slightly different efficacy levels in those differing parts of the world. Importantly, the Johnson & Johnson vaccine has about 83% efficacy with relation to serious symptoms. But most critically, it has 100% efficacy in preventing hospitalization and death. And that's really what's most critical from a vaccine. That is what we need: preventing hospitalization, preventing being put on a ventilator, and certainly preventing death. It's also important to note that those benefits come from a single shot, a single dose from the Johnson & Johnson vaccine. There are studies that are ongoing about the benefit of adding a second dose to that vaccine, but for the single dose, these numbers are very encouraging. In the end, the best vaccine for COVID is the one you can get. Don't get caught up in the brand or the manufacturer, and really trying to compare the efficacy numbers is just not an apples to apples comparison, as these vaccines were tested at different times and have not been compared head to head in the same trial. Our vaccinators around the county and certainly around the state may have little control over the type of vaccine they get, but you can rest assured that all 3 vaccines have been authorized and are safe and effective. Thank you very much. Stay safe, and I will hand it to Deputy Director Jackson.
Thank you, Dr. Weston. So first, let me start off with just some new information as it relates to our enforcement and compliance checks for the Moving Milwaukee Forward Safely order. The City of Milwaukee Health Department has been able to partner with a third party independent contractor to assist us in doing our compliance check. And this really just allows us as the health department to make sure that the order that we have in place, that we're able to go out, and as complaints come into the health department, we're able to respond quickly and efficiently to be able to address those issues and concerns as they come up. So we're grateful to the city attorney as well as our third party contractor and their willingness to do this work. Our additional workforce will be starting on Thursday. And again, this is additional workforce. So our City of Milwaukee Health Department staff will continue to go out as well to do compliance checks in addition to our additional workforce. Also want to start too by just sharing a little bit of vaccine information as it relates to the Milwaukee Health Department. So we did begin our vaccinations yesterday for educators, and I am going to put up a graphic if I can, Sydney. So I believe y'all can see that. Great, thanks. So what you're looking at is the schedule for the Milwaukee Health Department educator vaccination efforts for the next 2 weeks. And so on this graphic, which is also going to be at the Milwaukee Health Department website, you're able to see the locations and times of all of our vaccination spaces over the next 2 weeks, which include both at the Wisconsin Center as well as at North Division and South Division schools for Milwaukee Public Schools staff, as well as additional clinics at the Mitchell Street Library and the Villard Street Library for all educators, including early childhood. So just wanted to give this graphic, and again, understand that this is going to be on the website to be able to give some very good details for where people can go to get vaccinated. The process for scheduling into these mobile clinics, those 4 mobile sites, is the same process as to be able to register at the Wisconsin Center. So you would go to milwaukee.com/COVID-vax, and you would be able to go through the screening questions and then eventually get to the space that has you identify a location. You would identify the location you would like to get your vaccine at and then move forward through that process. So just wanted to share that, and I'm going to stop sharing now. And really just wanted to also give some numbers. As the mayor had stated, I want to really make sure that I acknowledge a few people throughout this process and a few organizations as it relates to educators only. As you all already know, this is an extremely large group, and it is not only the health department that is getting this work done by far. So through the support of the state DHS, both through doses and through mobile vaccination teams, between now, March 1st and March 14th, we are going to have over 17,000 doses that have been delivered and then administered into arms for educators in early childhood. So getting that many doses into individuals' arms is not going to happen just with the health department. We are really grateful for partnerships that have already been formed. First and foremost, Children's Hospital and Medical College have partnered with Milwaukee Health Department to provide some workforce support in the community. So you'll see a little bit more about that next week. But in addition, individual schools have worked and initiated plans with partner healthcare systems, both Freighted and Ascension, to be able to also provide vaccines directly to other particular educators. And then lastly, Aurora and UWM are also planning some educator vaccinations. So it is, again, through all of this work that we feel really comfortable that in the next 2 weeks, we will be able to get all educators that want shots and that want the COVID vaccine that they will have an opportunity to get it. We're really excited about that and just really grateful for all of the work and the priority around equity that has really been really shown in the last week or so as we have done this planning. So grateful for that. Lastly, just wanted to touch on mobile teams. Again, we are going to start this week with St. Ben's and All Saints Church to provide some mobile vaccination teams. And we plan to do about 200 vaccinations per clinic. Those particular sites are not on the website. Those are what we consider closed pods, meaning, again, our goal is to really identify a particular population and get those individuals vaccinated. So we will continue to move forward, again, knowing that the week of the 8th, all of our mobile sites will be focused on educators. The week of the 15th, which is the next week, we will continue with our mobile plan around equity. And with that, I will turn it back over to Sydney.
Thank you. Our first question comes from Patrick Palantonio at WISN 12 for Deputy Commissioner Jackson and Dr. Weston. When will doses of the Johnson & Johnson vaccine arrive in the city of Milwaukee and Milwaukee County? Since it's only a single dose and doesn't require extremely cold temperatures, what is the plan to administer this particular vaccine in the city and the county?
So I can start and then please, Dr. Weston, feel free. So we have not been given an actual date for when Johnson & Johnson will arrive. Once we have that information, we'll be sure to share it. I think one thing that everybody is really excited about with Johnson & Johnson is the fact that it is one dose and it's quite easy to move mobily. So we want to make sure that understanding all of the populations that we have to vaccinate, making sure that we're using Johnson & Johnson in the right way, very strategically on who we vaccinate.
Yeah, I would agree. The exact delivery date is unknown, and just as Deputy Commissioner Jackson mentioned, it's a much more amenable vaccine to a lot of different populations, and so we certainly look forward to exploring with the state and exploring locally how to get it to certainly underserved populations in particular.
Sorry, there's a lot of questions to wade through. Our next question comes from Rose Schmidt at CBS 58. When you say you want to be done vaccinating educators by March 15th, does that include childcare workers in your goal? Where can teachers / childcare staff who don't live or work in Milwaukee go to get vaccines?
Right. So our goal with the Milwaukee Health Department is within the next 2 weeks to give that opportunity to all educators and daycare workers and early childhood educators. So we feel with the number of doses we have and the partnerships that we've created, we should be able to get through those individuals who do want the vaccine. For anyone that is not living or working in the city of Milwaukee, they should contact their local health department to understand what options they have.
Our next questions come from Gabrielle Mays at Fox 6. For Commissioner Jackson, how did the walkthrough at AmFam Field go? Will fans be inside the ballpark on opening day? And then for Commissioner Jackson and Dr. Weston, are there any concerns about the new COVID-19 strain popping up in Wisconsin with possibly more headed to Milwaukee?
So I can talk about American Family Field and Dr. Weston can talk about the variants. So we did have the walkthrough last Friday with American Family Field. It went well. As anticipated, we did have feedback and some adjustments that needed to be made to the plan. And we're continuing to meet with the Milwaukee Brewers to go over those adjustments. But we're really optimistic that there will be fans in the stands on opening day.
And to answer the question about the variants, certainly it's absolutely a concern. We see different parts of the country, in particular Florida right now, hit hard by the B117 variant. We know it's in Milwaukee County. And when we know it's in the county, we know it's spreading in the county. And so it's certainly something to keep a close eye on. A lot of the country, or much of the country, has seen an inflection point now in cases as well as testing. We're seeing a similar trend just starting in Milwaukee County. So those will be important numbers to watch.
Thank you. Our next question comes from Ben Wagner at WISN 12 for anyone. Do you know how many teachers/school staff were vaccinated yesterday and today? How many of those were MPS staff? Any idea how many are scheduled to be vaccinated this week?
So I can share that we vaccinated over 1,000 individuals yesterday at the Wisconsin Center. We don't have micro level data on quite yet. We haven't analyzed that on the individual breakout there. And we're planning to do over 5,000 specifically at the Wisconsin Center. Again, understanding other vaccinators across the city are also vaccinating. Would also point out just to the general question around how many teachers have been vaccinated, understanding that the Milwaukee Health Department is not the only vaccinator. So Walgreens, and there's other pharmacies, as well as, again, other healthcare partners that are also vaccinating educators as well.
Thank you. Our next question comes from Allison Durr at the Milwaukee Journal Sentinel for County Executive Crowley. How many people receiving county services, not including county employees, were vaccinated at the Kosciuszko Community Center last week? And how many people receiving county services will be vaccinated this week at the site?
And feel free to jump in any time, Dr. Weston, but I don't have those numbers readily available at this time, but I can tell you that our Commission on Aging, Department on Aging, continue to make phone calls for the people that we are served that are eligible to receive the vaccination.
Right, and I can expand a little bit on that. I think they have made about 100 phone calls so far to their service users. And I believe around 30 of those have received vaccine at this point, and a lot continue to have appointments scheduled yet this week.
Thank you. The next question from Allison Durr is for Deputy Commissioner Jackson. Which third-party company will be assisting with enforcement, and how was the company chosen? Will they be sending complaints to the health department, or will they be able to issue citations?
So our third-party vendor was chosen after a selection process to identify individuals who do process serving type of work, number one. And secondly, the complaints come directly into the health department, and then the health department then triages those, and depending on what the complaint is, we'll decide who is the appropriate person to go out, whether that's an Milwaukee Health Department staff or whether that is part of our third-party vendor staff. In addition to that, to make sure I got it all. Oh, so as it relates to citations, so the citations are actually issued by the Milwaukee Health Department staff after the information has been transferred back to us.
Thank you. Our next questions come from Sari Lusk for Deputy Commissioner Jackson. The first question, we're in the 4th week under Milwaukee's current health order. The order was expected to be in place for at least a month. What have you seen in the last few weeks in terms of compliance and impact on the city's gating criteria? And what, if any, changes are you planning to the order, and when?
So over the last month, we've seen really slow, almost flat declines in our total percent positive, and our other gating criteria have all trended generally in positive direction. So that is a great sign. However, that what has already been shared as it relates to the new variants is something that gives us pause and makes us just want to make sure that we are being very cautious moving forward. So as you all know, we have a new commissioner that'll be coming soon or will be here soon. And so we are working with her to make sure that the next order that comes out really make sure that we are addressing being cautious while optimistic.
And a follow-up question from Sari Lusk. How long is the contract with a third party? Are checks now only complaint driven without spot checking? And how quickly will they respond to complaints? Immediately or only during a certain days and times?
Okay, so the contract is for 6 months, is our typical contract timeframe for the city of Milwaukee. So that is that question. As it relates to compliance checks and are they complaint driven, they are not only complaint driven. We do spot checks. However, we are doing both of those, understanding that the work of this particular contractor is to address issues during weekends and nights, which are mostly complaint driven.
Sorry, the next question comes from Rose Schmidt, I'm sorry, at CBS 58. DHS announced certain Kroger stores will start to receive COVID-19 vaccine as part of the federal pharmacy program. Do you know if that includes any Pick and Save or Metro Market stores in Milwaukee?
I do not have that information. I do know that Pick and Save is a subsidiary of Kroger, so I suspect that they would, but I don't have information to confirm that.
It looks like we have just one or two more questions. Apologies, Commissioner Jackson, Sari Lusk also asked, who is the third-party vendor for enforcement? If you already answered that, I apologize.
So the third party is known as Elite Elite LLC.
Thank you. The next question is from Ben Wagner at WISN 12, a follow-up on the educator vaccines. Does the health department track how many teachers and staff have been vaccinated at city-run sites?
We do our best to do that through our screening process. As you know, once you go into the Milwaukee Health Department scheduling system, there is a screening process that leads you to identify yourself as an educator versus other eligible groups. So we are doing our best to track that.
It looks like we have one more question in chat. Media, be sure to enter any other questions you may have. The question I'm seeing now is from Patrick Palantonio at WISN 12. What is the plan for concerts at American Family Field this year? And what is the process for those shows to happen?
So like with the rest of our venues that want to have any kind of event over the 25% or 250, they would have to submit a separate safety plan that would address all of the issues that would come with that particular venue or that type of entertainment.
Thank you. That appears to be the last question that's come through in chat. Last call for questions. All right. Thank you everyone for taking the time to join us today. We will see everyone back here on Thursday.
Thanks, everyone.
Thank you.